according to Public Health England, there's been a small amount of community transmission of the South African variant. Professor Susan Hopkins says two-thirds of the cases of the variant have been linked to travel, but in pockets around the country, with the largest transmission in London. According to her, there is a new Indian strain, but not yet enough data to classify the new strain as a variant of concern, as investigations continue whether the variant might spread more easily and evade vaccines. Well, to talk more about the variants is Dr. Godfrey, Wechie, hospital doctor with the NHS. He joins us now from Birmingham in the UK. Thank you for joining us on the program.
Well, thank you, Melissa, and thank you.
All right, Dr. Wechie, let's start with the Nigerian variant. In a county, we understand, southeast England, sparking fears that it may be deadlier than the South African form. What do you know about the mutant strains?
Absolutely. So there's a new strain that's just been more common that's basically been seen much more amongst Nigerian travelers, people that have come to the UK from Nigeria. I don't actually think it's a Nigerian strain, to be honest, but and that's the thinking now. And the thinking may actually be a very, very deadly strain of the virus, a mutant strain. And that's because it has a mutation which was also found in the South African and the Brazilian strains as well, and which makes the virus much more easy to actually avoid and evade the immune system, even after you've actually had the vaccination. But it's actually currently being studied in the UK.
So the UK is moving quite well in its vaccination program, but hearing that this variant might evade vaccines, especially the Pfizer-BioNTech one, is rather serious. But with the reports on some of the vaccines like the AstraZeneca, Johnson & Johnson, and the rare complications, at the end of the day, is vaccination about the only solution to keep down the pandemic?
Absolutely. You know, this pandemic, we have to actually come at it with various strategies. Vaccination is obviously one of them, and it's actually one of the key things we actually have to do to try and come off this pandemic. The other thing we have to keep doing is actually to carry on with the personal protection that we do ourselves, wash your hands regularly, kind of still follow government guidance on social distancing, and also, try and, if they say not to go out, try and just basically not go out. But basically, vaccination holds a very big key to actually coming out of the pandemic. And that's because if you vaccinate enough people, then at some point you get to a point where you have what they call herd immunity, which means that transmissibility is going to actually be quite low amongst the people, and the effect of the virus actually going to be quite lower compared to if we haven't vaccinated people. Also, the other findings from research that has been done so far shows that regardless of what mutant strain you've actually got, if you actually end up getting COVID infection and you've actually had one of the vaccines, then your risk of actually dying in hospital and also of actually ending up in hospital is actually lower than someone who's actually not had the vaccine. So vaccination is actually the way to go.
In terms of vaccine hesitancy, tell us a bit about your experience as a medical doctor who was skeptical in taking the COVID-19 vaccine at first. What changed?
Absolutely. So, in terms of my own personal experience, it was quite difficult to get me to the point where I was going to accept taking the vaccine. I've actually had the Pfizer vaccine now. And it was, when we had the second lockdown, it was very serious. We didn't have enough doctors to look after unwell patients. And they had to pull doctors who were not ordinarily patient-facing were actually pulled out to actually work in acute medicine. So I was redeployed back to acute medicine. And it was actually during my time in acute medicine that I actually realized, look, this is actually real. People were dying, You see a patient today, a couple of them, you come back and they basically passed away. Even young patients, a lot of them even having, kidney failure. And by the way, and that kind of was quite scary, and that at the end of the day made me, realize that this is actually not something to joke about. And I've had my vaccination now. And the other thing I wanted to point out as well is that when you have the infection, it's not just, you may actually not know you've had it. So when they say, avoid other people, follow social distancing, wash your hand and do all that, we're not just saying that because we want to try and keep you away from other people. No, it's actually to try and keep you safe, because even if you get this infection, COVID infection, and you don't know you've got the infection, what ends up happening is the long-term sequelae of having that infection, even if you don't know you've had it. You may end up getting lung fibrosis, for example, get long-term damage, and you haven't actually realized that, you've had it, so it's, even if you don't know or you don't actually become unwell, you can actually catch the virus and go on to develop complications in the future. So it's actually quite good to actually protect yourselves.
So essentially, vaccination, the benefits outweigh the risks. Thank you, Dr. Godfrey
Absolutely.
Wechie, hospital doctor with the NHS. Thank you for joining us on the program.
Pleasure, my pleasure.